Welcome back to Aging and Awesome. You know, like many other conditions, older people are more likely to suffer from TMJ. And if you're clenching your jaw or you're grinding your teeth during your sleep, you may not even be aware that you have it. Joining us now is Dr. Tammy Neugebauer of TMJ and Sleep Therapy Center of Reno. She is the expert. Welcome to the show.
Thank you so much.
Well, so first of all, what is TMJ? I mean, I know it's got a big long name, but it's problems with your jaw, right?
Correct, that's what it is. So TMJ usually happens to do with clicking and popping of your jaw. Sometimes people have a lot of pain associated with it. So what we want to do is find out why that's happening to people.
Yeah, and what causes it to happen? What are the causes of it? Is it something that develops over time?
Correct. So when you clench and grind your teeth, it causes breakdown of the jaw joint tissues. So it starts with inflammation. The inflammation starts to break down the jaw joint tissue. So typically happens at nighttime. We bite 5 times harder than we do during the daytime. And what happens is you wake up and you swallow. We swallow 25 times an hour. So you continue to injure that body part. And throughout a lifetime, that inflammation starts popping clicking sounds. And over time, the tissue between the jaw joint and the skull gets stuck out of position. Mm-hmm. And so over periods of time, people can actually get to the point where they can't open or they can't close their jaw. And sometimes it can actually affect the bone. So people who tend to have arthritis, it can actually cause arthritic changes of the jaw joint, which also can limit their ranges of motion. Oftentimes, TMJ symptoms can be confused as dizziness, ear problems, headaches, migraines. And what happens is when the jaw becomes dislocated, it translates to the back of the neck, the shoulders, and your lower back.
And it also can affect like your sinuses and your nasal passages. I mean, when you're trying to diagnose it, you have a lot of things to look at.
So actually, the reason why jaw joints most likely deteriorate happens to do with the nasal obstruction. So normal functional breathing should be through our nose and our nose only. If there's any limitations of breathing, then you have to breathe through your mouth. So that constant wear and tear on the jaw joints is a result of most likely a nasal obstruction.
So then what do you do for it?
So the number one thing we want to do is find out why it's happening to patients. So we do a very thorough evaluation that we take an x-ray of the head and neck so we can actually see the airway from the tip of the nose down their throat to see if there's any limitations of airway breathing. And then we look at the jaw joints. Is it inflammation? Is it arthritis? Is it dislocation? What is the true diagnosis with that? So when we find a diagnosis, then that allows us to come up with a treatment plan to rehabilitate the jaw joint and improve ranges of motion, patient's quality of life.
I mean, how successful are you? Is it to kind of turn things around for them once you figure it out?
Very, very successful. The longer it goes, the harder it is to fix. And the one thing people don't understand is the jaw is actually a healable joint when we treat the reason why it's deteriorating in the first place. It's different than any other joint in the body because it's there to eat, breathe, and speak. It's very important for survival. So people, when you have these issues and we treat the root cause, then the success of improving or resolving the symptoms is extremely high.
So if people do feel like they are having a problem or want to be assessed for it, how do they get a hold of you?
Our office is the TMJ Sleep Therapy Center of Reno. Our address is 9710 South McCarran Boulevard. Phone number is 775-786-3472, and we'd be happy to help them.
Good enough. Thank you so very much, Dr. Tammy Neugebauer. Thank you.